Perhaps you have experienced a feeling of heartburn after completing a meal? Or, how have you ever felt heartburn and/or torso pain whatsoever before? Oftentimes, heartburn may occur after eating certain foods, particularly highly fatty and acidic ones. Presently, 1 in 10 Americans encounter GERD symptoms such as heartburn. Are you or somebody you know among these 1 in 10 Americans? If this is so, you will find ways that you may help cure GERD and its symptoms. Though pharmaceutical drugs are frequently utilized to treat GERD, cannabis and distinct cannabinoids can help cure this disorder safely and efficiently. Keep reading to learn the function cannabis plays treating GERD and its symptoms. GERD describes chronic symptoms such as irreparable damage which was initially made by the abnormal reflux inside the human body's esophagus. A lot of people experience acid reflux, which can be relatively common and not overly severe. But chronic acid reflux in the shape of GERD can become a serious health problem. At the simplest of terms, GERD is made up of the yield of material inside the human body's gut, which backs up into the esophagus. Next, if this happens, the stomach's content may flood up into your system's esophagus, that is in the entry of their human body's stomach. If the less does not shut correctly or if it opens frequently, it is feasible for stomach acid to maneuver in the human body's esophagus and result in heartburn. Ordinarily, the primary therapy method for GERD is that the usage of prescription drugs or over-the-counter medication. But several prescription drugs cause negative side effects. Luckily, however, different cannabinoids can fight GERD symptoms and unwanted side effects which happen from prescribed GERD drugs. Moreover, specifically though, the ECS can display anti-secretory effects on gastric acid along with preventing inflammation and mucosal damage that is commonly believed by GERD patients. Your human body's ECS also has an influence on the human body's passing less, which can be quite valuable for individuals suffering from GERD. Generally, cannabis includes a broad selection of medicinal properties such as but not limited to the capacity to assist in improving acid reflux. But, among the most famous medicinal advantages of cannabis is its own analgesic, pain-relieving properties, which may be helpful for treating GERD. Lately, it's been found that the CB2 receptor may downregulate inflammation and hypermotility in the disease condition. Your human body's ECS may also enhance gut motility in the setting of inflammation as well as regulating intestinal propulsion. What's more, one analysis concentrated on the management of delta-9 THC from GERD participants. To begin with, it is important to understand what TSLERs are earlier knowing the study's outcomes. TSLERs are described as transient sphincter relaxations. That's the overriding mechanism that is found in GERD patients. TSLERs happen after gastric stimulation and distension, and they are often known as the primary reason for GERD. In the analysis mentioned previously, it was found that delta-9 THC significantly reduced the amount of TSLERs in participants as well as causing a decrease in acid reflux episodes. But more research needs to be conducted to better understand the part of the human body's ECS in clinical function and disorder. Thus far, however, preliminary data demonstrates that there is a possible usefulness of cannabinoid receptors decreasing TSLERs in GERD patients.